Good morning, everyone, and welcome to Invitation to a Conversation. Look at the time. We are down to the last day of 2023. And this day is special because I've been waiting for this conversation all year long. This morning, our topic is Medicare. And to have that conversation with me is Miss Patricia and Mr. Gregory Mitchell. Good morning, Miss Mitchell. How you doing?
Doing very well, thank you. How are you?
I'm good. I'm good. Excited about going into the new year. Just starting a new year.
Yes, 2024. It's hard to believe that we're in at the end of the year. It's hard to
But I
believe.
just thank God for life. Just thank God for life to be here to celebrate it. So, Miss Mitchell, can you first tell us how you got into the career with Medicare and being a specialist and being a consultant to it?
Well, I started in the insurance industry because of a tragedy that happened within my family. My grandmother, Miss Otherdine Pickett, or they call her Miss OC, passed away in 2007 on Mother's Day. And at that time, I was a school teacher, full time school teacher, and I was working on my doctorate degree. And I think I was in Boston um, in school working on my doctorate degree when I got the news. Um, but she passed away, and we got a $39,000 bill from the Centers for Medicare and Medicaid Services, that's CMS. And, I'm a well educated person, and I thought, you know, that I knew a little bit of everything, but there's some things that if you're not versed in them and you're not trained or taught, or you're not there in the moment, it doesn't pertain to you, you're not going to know anything about it. So I was uh, baffled by the fact that she had Medicare and Medicaid. And what I thought was because she had Medicaid and Medicare, that 100% of her bills were paid. And what I learned is that there were different kinds of Medicaid. And when my uncle put her in the nursing home Medicaid is what prompted CMS to say, hey, sell your grandmother's property and pay this $39,000 bill, because there's something called the Medicaid Recovery Act that was new in 2007. It was maybe at that time, Georgia was one of the last states that adopted the Medicaid Recovery Act. And I was like, well, what does that mean? She still had Medicaid. Her check was only $660 a month. So how can she afford to pay $39,000? And they said, well, the assets that are still in her name, if she didn't have them out of her name within 3 years of, if she didn't have them out of her name within 3 years of passing away, then they would be able to lay claim on her property. And I say lay claim, they would put a lien on it so nobody can make improvements on it. You can't get a loan on it. You can't rent it. You can't lease it. You can't do anything with that property. And so I went, my sorority sister, hello, Deltas out there, all Greeks, hello. But my sorority sister said, hey, Pat, you are stressed, girl. Come on, let me take you out to eat. And we went to Longhorn Steakhouse. And there was a gentleman there who was having a dinner meeting. And I just heard him say the word Medicare or Medicaid. I don't know which one he said to this day. But I asked him, could I ask him some questions about my dilemma? And so he sat down and, he was cool as a cucumber. He was an executive. I didn't know it. I just bumped into, uh, bombarded that conversation. So he broke it down in layman's terms what that Medicaid Recovery Act meant and how it applied to my grandmother and how there were different types of Medicaid. And if she had what's called QMB Medicaid, the Medicare savings, which helps pay the medical bills, um, that you don't have to necessarily pay back. But when you get put in the nursing home, if you don't have the money to pay the bill and you still got property in your name, they're going to come for their money, right? So, long story short, he told me to get a lawyer, get an appraiser, and we had grandmother's property appraised, and it appraised under $25,000. And CMS said, "Thank you, you don't owe us anything." And, I know it's only by the grace of God, and it's that we were able to bump into this gentleman that evening. And also, it's by perfect design that God led me into the insurance industry. And what the gentleman told me after I gave him excuse after excuse of why, nope, I'm not doing insurance. I'm a school teacher. I got two children. I have four now, but I have two children. I don't need another job. And he said, "This is your destiny." He said, "Your grandmother was blessing you in her death to help people understand Medicare, Medicaid, and the finances and the costs that are associated with it." He said, "You're going to be a blessing to so many people because you have lived through what a lot of people will be faced with. So you can help guide them." And everything he said has been true. And that was 2007. So, it's just been a blessing helping, thousands of people understand Medicare and Medicaid.
Thank you for that story, and thank you for following uh, that man's advice and getting into it. So let's break down some of the stereotypes or the myths, and and peel back. If we have to do a part two, we'll do a part two. Um, and so, but we're not constrained for time. I'm not constrained for time with this conversation. So start from the beginning, and since you know information on both Medicare and Medicaid, let's do Medicare first and then go into Medicaid and discuss the different types there is, the different letters, and what's most important, our last conversation part of the conversation, is to warn people or tell people or enlighten people about their assets of preparing themselves if they get put into a nursing home or anything like that, and what they should do to get their house in order so this won't happen to them. Okay. So
Okay.
first of all, how is so for the millenniums and Generation Z or whatever, because this video is going to be forever on social media. Explain how the money gets into Medicare. We're going to act like that I'm illiterate to everything. So explain how Medicare money is accumulated and how they determine who gets
Who's
it
up?
and who.
Mhm. All right. So the FICA taxes, the Social Security taxes, the Medicare taxes that come out of each of our checks when you're on a W 2 job, or if you've got a 1099 and you're paying yourself an income, you still have to pay into Social Security, because if you don't pay in anything to Social Security for your Medicare, you don't get anything out. So, in order to qualify, you have to have 10 working years of paid in taxes. And you cannot have a break of 5 years without work. So, what that means is you are disabled. and you apply for your disability, right? Anybody 16 years old or older can get Medicare if if they have been deemed disabled by Social Security and their doctor. A lot of people who are not working or haven't worked in a while and they apply for disability get denied because they don't have any work experience, number one, and number two, they don't have that trail for a doctor. So applying for disability is not just, oh, my back hurt, oh, my leg hurts, oh, I got this, that, and the third. It has to be documented with a doctor. So you have to have ongoing medical care for your situation. So you can't just say, I can't work because of my back. I can't, it doesn't work like that. There has to be documentation. There has to be a paper trail. There has to be a treatment trail. So a lot of people get denied for disability. But once you've been disabled for 2 years or 24 months, then you can apply or you get Medicare based upon your disability. So Medicare is not free. Medicare is not free. Your Part A is $0 a month because you're 10 years, 40 quarter hours of taxes have paid for your Part A, right? And if your income, when you become Medicare eligible, whether it's aging in at 65 or getting it on disability at 16 and over, right? It's if your income is over 89,000, $90,000 a year, then you may have to pay more than the average person who is receiving Medicare. And so they calculate that it's uh, this year for 2024 coming up, it is 174.70, $174.70 for Part B. Part A is zero because again you paid in those 10 years or 40 quarter hours into Social Security. And so these groups of people that I'm about to name are the worst at not qualifying for Medicare because they have not paid into the federal government money. So that money that is, I worked 27 years as a teacher before I retired, right? So for 27 years, my money was sitting up there in the Federal Reserve Bank, just drawing interest and waiting on me. I hope I don't get Medicare until I turn 65, but should I become disabled before then, I've got that money there that will pay for my Part A premium, but my Part B, I have to be in place to pay that 174.70 or whatever it is at that time when I become or you become Medicare eligible. And so the Medicare Part B is Medicare Part A and B, they're two different parts. So Part A, I tell people Part A is like hotel insurance. So when you go to a hospital, there are several facets. There are several overheads that have to be paid besides your physical care. So the people that don't work on you, the electricians, the cafeteria workers, the custodians, the groundskeepers, the maintenance workers, those people, their money comes out of that Part A pot of money. It comes out of that Part A pot of money. So you think going and staying overnight in a hotel, we're paying $250 a night. So when you go to a hospital, when you enroll in a Medicare Advantage plan, Part C, you might be paying $250 a night. That might be your copay per day for the hospital. And that's a drop in the bucket to what hospitalization really costs. Hospitalization, you know, the electrician makes probably more than a doctor. They're making $100 an hour. The plumber makes $100 an hour, right? besides the kitchen staff that's preparing the meals. So part A is for basically the people that don't work on you. So when you go to the hospital, don't say, oh, that doctor charged me too much money, because it's not that. And then the administrator of the hospital makes the most. They get a set fee of how many ever $1 million a year, where the doctor has to work for his on an hourly, whatever he charges for that service, right? So part B, medical, is for the people that work on you. If you were to look in your Medicare and You manual and it explains part A and part B, you will see part A has a picture of a hospital building. Part B has a stethoscope. So think the stethoscope, the people that work on you, the nurses, the anesthesiologists, the radiologists, the doctors. So everybody that takes care of you gets paid for under that part B. So that 174.70 is your monthly premium for part B. Now, everybody doesn't have to pay the part B premium, right? Those people whose income that's under $1,256 a year can apply for what's called the Medicare Savings Program. And I know we said we're going to talk about Medicaid later, but you have to bring this in. The Medicare Savings Program is a form of Medicaid. It's help you get from the state to help pay those monthly premiums for Part A and Part B, because those people who did not work 10 years, 40 quarter hours, and I didn't name them. For example, waitresses, they get cash money. Like now that a lot of people are paying with cards, so the employer is required to make sure that they pay their FICA and Social Security, Medicare taxes on that money, right? When they give it to them from the check. But those waitresses, they pocket the cash money and don't think about, hey, I need to claim this as income so that I can have Medicare or health insurance later should I become disabled. Construction workers, those people that are contracted, just to come and lay the bricks and mortar or, put up the foundation, those people are paid cash money. So it's a benefit to the construction owners because they're evading taxes. But it's a disservice to the worker that's doing the manual labor, because then when it's time for them to become, uh, when they get older or if they become hurt on the job, I have a gentleman right now fell off the 18 wheeler, unpacking it, fell off the top of it, and now he's disabled, right? He broke his back, broke his leg, and he's but doesn't have enough quarter hours paid into Social Security to get the Medicare, right? So now he's between the rock and the hard place. Um, and the family can't pay for the care, right? And now they want to get life insurance. Now they want to get the indemnity policy. Now they want to get the advantage. Now they want to get all of that. But when you need it, it's too late to get it. I mean, that's you can pin that one. When you need insurance, it's too late to get it, because the time to get it is before you need it. Because once you're disabled, once you're sick, once you have a catastrophic illness, once you have um, like this gentleman fell off the back of the truck, you can't, nobody's going to touch you because it's a gain for the individual. All right, insurance is never for the gain of the individual. It's a risk that the insurance companies take on to cover you in the event that something happens. But if something has already happened, then the risk is already present. So they're not going to insure a present risk or present illness. So Medicare is not free, right? But if you have low income, it can be zero premium. because you can, long as you qualify, it don't matter if you get $200 or $100 a month from Social Security. Long as you got that um, um, 10 years in, you can get Medicare, right? And then we can help you apply for Medicaid. And then there's something called extra help. So the extra help is through Social Security, which we can help you apply for that to help you pay for your medication costs. So Medicare Part A, zero, as long as you work 10 years, 40 quarter hours, and your income is under 90,000. Part B, 174.90, unless you have Medicaid. And Medicaid is for people on Medicare. It's called the Medicare Savings Program. And so what happens when people go into the Department of Family and Children Services, they'll go in and say, hey, I want to apply for Medicaid. And looking at me or you, thankfully, we don't look like we 60 years old, right? So they're not going to assume that you are Medicare eligible. So they're going to give you the women and children Medicaid. They're going to give you, the regular Medicaid for people without Medicare. And guess what? You're going to get denied, right? Because you don't qualify. Georgia did not extend Medicaid for the average person. They did
Mm,
not extend it, right? So you have to be specific when you go into the DFACS office and you say, I have Medicare. I would like to apply for Medicaid. Then they will give you the Medicare Savings Program. But if you don't differentiate, they're going to give you the wrong application and you're going to get denied. Even though in your heart of hearts, my income is less than, you know, $1,300 a month. And there are different levels of Medicaid as well. So you can have full Medicaid at the 1256 and below. You can have partial Medicaid at like 1356 and below. And you can have another partial Medicaid at 14, almost 1500 something dollars and below. So there are levels. Full Medicaid is 1256 and below, right? If you're under 1500, then you might qualify for the other two levels, which those two levels partial only pay your Part B premium, which is the 174.70. But the full Medicaid pays the Part B premium, it pays your copays, it pays your deductibles, it pays all of that. So what people are duped into doing is calling those 800 numbers off the TV and the commercials. They're duped into call now. You may qualify for extra benefits, but they don't tell you how you qualify. They just want you to call and then they just sell you something over what you have. So here's the hook that they get you with. Oh, which plan do you have right now? Oh, I have United Healthcare. Oh, well, I work with United Healthcare. But if you said, oh, I have Aetna, they would have said, oh, I work with Aetna, right? To make you think that they work with the company that you're with, which they may have. And a lot of times the telemarketers that are calling, they're calling from Mexico, they're calling from Peru, they're calling from Timbuktu, right? And so once they get you on the hook and you say yes, then they're going to say, hold on, and you're going to hear beep, and then they're going to connect you to somebody that's sitting there at their computer waiting to click and buy your information. And then they're going to transfer you to that um, telemarketer, that insurance agent sitting on the other line, and they're telemarketers. So a lot of these people don't even, they work for another um, big corporation and they get paid pennies on the dollar just to do your application. And so they are hungry. They are hungry to get you take, they're hungry to take the money and get your enrollment. So Be careful. Don't talk to those people. You know, we're local. We can see you on the computer. We can do a Zoom, right? We can come to your house, or we can meet you at a restaurant. I met you at a restaurant, Old Time Country, where I was meeting with 4 clients that day, right?
Mhm.
At the Old Time Country there in Brunswick. So
Mhm.
it's all different kinds of ways to meet people need. But what I find is that people are skeptical when they can reach out and touch you, but they're so willing, and it's just mind-boggling to give up their information over the phone. And you don't know who these people are. You'll never ever talk to them again, because your information is going to be passed from this person to this person to this person to this person. And you don't have anybody to help you navigate the customer service and all of that stuff. So don't don't mess with these telemarketers. And those flyers that you get in the mail, you need
Mhm.
to rip them up and throw them in the trash. If you want to speak to somebody local.
Your button was hollering at me. You had on that big button that said, I think it said, if you want to know about Medicare, ask a
You,
question or whatever.
right. Ask
I
me
said,
about
there,
Medicare.
there you are, right there. I've been looking for a while. So, is there a so? I always say a penny makes a difference. Is it a what? Do you know the monthly number that a person has to make, or the limit, a monthly limit, whether they're qualified for Medicare or not?
No. I mean, if you get, so when you become Medicare eligible, whether you're aging in at 65 or you're getting Medicare on a disability, if your Social Security amount is $1 a month, you the ticket is you have to have those 10 years of 40 quarter hours of Social Security taxes, FICA taxes, Medicare taxes paid, right? So, but if you're not receiving your Social Security benefits at the same time you're getting your Medicare, then you have to find a way, whether through a checking account or sending in a coupon book, coupon payment. You have to set up a payment for Medicare. But I think your question, you asked me, is there a limit?
Monthly, yeah. Is there a monthly amount that a person has to make in order to be qualified or non to be qualified to pay that 174? What is, like they say, if you make 2,500 a month, you can't be you're not qualified to not pay for
Mm-mm.
it. How does that go?
So 1256 and below. If your income is 1256 and below, you might qualify for help to pay the Part B premium, right?
Okay. Mm-hmm.
And but you don't get that help automatically. You have to um, you have to apply for it through
Mm-hmm.
you have to apply for it through DFACS, Department of Family and Children Services. So there's not a monthly amount that you need to make to qualify for Medicare. You have to qualify for Medicare based upon disability or your age, 65, and you have to have those 10 years of 40
Yes.
quarter hours paid into Social Security with work experience. So,
So
Greg, let me ask Mike, Greg. So the amount they make for Social Security to qualify for a quarter of Medicare.
Every year it changes. Like this year, 2024, it's about $1,700 a quarter. A little more.
So, in order to qualify for Medicare, someone
Four
has to
quarters
pay
of it.
in $1,700 of income a quarter. So, if you multiply 1,700 times four, that's how much they have to make in a year to qualify for those
mm,
4 quarters. And you remember,
Hmm.
you got to have 10 years or 40 quarter hours to qualify for Medicare. So they have to make at least $1,700 a quarter in order to qualify for that one quarter of work. But to qualify for Medicaid, their income has to be under $1,256 a month.
Okay, gotcha. Thank you. Okay, all right. So you were talking about part that's in Medicaid. Medicaid is the only one that has part A, part B.
That's Medicare.
How
Medicare
many?
is Part A and Part B.
Okay. What are the other letters that come underneath
That's
that
a great
umbrella?
question. That is a great question.
It's
So,
Mhm.
quarters of coverage is 1730.
if you can, my husband just pulled up some information, and I know you probably can't see it.
I see it.
Uh,
Quarters of
Yes.
coverage credit 1730.
okay,
Okay. You have to make
17,
that's now. You have to make 1730 a quarter.
right,
Mm-hmm.
right, to
Okay.
qualify for that
At least.
quarter. Mm-hmm.
Have 10 years of
That's
coverage.
10,
great
10 years a
information.
quarter. So $1,730. That's how much they have to make in 3 months. I mean, if you can't make $1,730 in a quarter, but like I said, waitresses, they make, thousands of dollars,
Right.
but they don't report it. So it
Right.
has to be reported.
All right. So yeah, so let's go back to the letters. What's the
Okay.
find the different letters?
All right. Part A, hospital. That's your hotel insurance. Part B, that's your medical, the doctors that take care of you. Then there's Part C, which came in 1995. So Part C is a combination of Part A and B, and it can also include Part D, as in drugs. So Part C is a not government funded. Well, it is government funded. Part D is run by private insurance companies. So the Aetnas, the Anthem, Blue Cross Blue Shield, the United Healthcare, the Humana, all those different companies. But they have a contract with the federal government to cover the risk of hospital and doctor. So Part C takes the place of your part A and B, but you still have part A and B because part A and B is used to cover hospice in any situation. So part A and B, go
So
ahead.
part A is the basis for everything.
No,
Part A is a
part part A and B together are the basis for everything.
basis for everything.
You
Okay.
have to have part A and B to qualify for part C.
Mm-hmm.
Part C you get because you have A and B. Part
Mm-hmm.
C, though, is going to offer someone benefits that part A and B are not going to. So so your part A covers the hospital. Part B covers the medical,
Mm-hmm.
even the doctors that work in the hospital. Part C is going to cover the hospital, the doctors. It's going to cover um, transportation, possibly. It's going to cover over the counter, like vitamins and um, lotions and powders and back braces and stuff like that. The part C is going to cover eyeglasses. The part C is going to cover gym membership. So when the private insurance companies contract with Medicare Part A and B, when they have that contract with the federal government, part of that money that they get from the government has to provide extra benefits to the Medicare beneficiary. And when you hear the word beneficiary, that doesn't mean life insurance only. So
Right.
that's anybody that's receiving Medicare. So beneficiary is somebody that's receiving something. So the Medicare beneficiary, when they get a private insurance funded Medicare plan, they can get those extra benefits that you see blaring on the TV, the grocery card. And every plan is not equal, right?
We
Every
go
plan
right,
doesn't have, the bells and whistles. They don't all have the same. So every company is competing to get your business. So they're going to offer something that maybe you may need something that, some people may need dentures. You know, we don't need dentures. We got our teeth, so that's not important.
right,
What's important to you might be your medications, right?
right.
Making sure you get the insulins or whatever you get. So then there's part A and B, that's Medicare original. Part C, that's called your Medicare Advantage plan. Part D started in 2006. Part D is the newest part of Medicare. So Part D is in drugs was started after Medicare started because Medicare Part A and B started. I always use this as a trivia. Started in 1965.
Mm,
For 1965 is when Medicare, original Medicare, was started because people didn't pay attention to their healthcare costs. You know,
mm,
they we make money to spend money on the material things, the car, the house, the car insurance, the house insurance, but we
mm.
don't necessarily plan for health insurance. We just
Right.
live life vicariously and think we're gonna not break down. But you have to plan for health insurance like you do the car you drive because when you're dead and gone, that person you least like the most is gonna be driving your car and they're gonna be living in your house.
Not the
So you
least.
have to plan. The person, look, it always happens like that. The person you least like the most gets everything you have.
So is D the last letter underneath the Medicare part? Is that the last letter D?
So the parts of Medicare, the
Yes,
A, B, C, and D,
D.
but
Okay.
right. So those are the four parts of Medicare. But then there's the other side that comes with letters also, but those are plans, PLAN. A Medicare supplement plan or policy is like the car insurance or the house insurance that you buy in the event that the deer runs out in the road and hits you, right? You got insurance to pay for the damage the deer did to your car, right? Most
Mm,
people drive to be safe. Most people don't live to be safe. We smoke. I don't smoke. People smoke. They drink. They do, dangerous jobs or dangerous activities. And, but you won't be out there doing, um, unless you're a race car driver, you won't be out there going 200 miles an hour on the highway because you're scared
mhm,
you're going to get a ticket. And plus, you don't want to have a crash and hurt yourself, somebody else. But people, again, don't plan for health insurance. They plan for keeping material things in place and not
mm.
keeping their body in place. So the Medicare supplement will go with original Medicare. So a supplement goes with the original Medicare, whereas a Medicare Advantage plan takes the place of original Medicare. And you don't use the red, white, and blue card with an Advantage plan, but you keep it in a safe place because, God forbid, you might need it for hospice. A
Okay.
Medicare supplement plan picks up the 20% coinsurance that original Medicare might not pay. It picks up, extra pints of blood or what have you. But a supplement, a lot of people say, I don't pay anything. I got a supplement. But a supplement, they pay a hefty monthly premium for a supplement, whereas they might get an Advantage plan for $0. A supplement is going to cost them $100 plus a month,
Okay.
in addition to their 174.70. So a supplement is not $0 like a Medicare Advantage plan can be $0. And the reason why a Medicare Advantage plan is $0 is because that money that you paid into Social Security, that FICA taxes, that Medicare taxes, it funds the Medicare Advantage plan. So the
Mm,
Medicare Advantage plan gets paid a fixed amount every month from the federal government. So that Medicare Advantage plan may be $0 a month because it's making, if the government is paying United Healthcare $1,000 a month when you enroll in the plan, or $2,000 a month. I don't know what they pay the insurance company, but I know it's enough for these insurance companies to be billion-dollar companies, right?
right. So let's go over the two cards that come with Medicare. They don't come with Medicaid. They come with Medicare, over the counter and the prescription drugs. Can you explain that? Because
So,
everybody doesn't get that.
right. So prescriptions and over the counter do not come with original Medicare. Prescriptions and over the counter do not come with original Medicare Part A and B. You'd have to get a separate Part D plan that's going to cost an additional monthly premium, or you can get a Medicare Advantage plan Part C that comes with the Part D at no cost. And again, if your income is low, under $1,800 a month, you might qualify for extra help to pay the monthly premium of the Medicare Advantage plan that has a drug premium, or the monthly premium of the single Part D prescription drug plan. But it doesn't come to you automatically. You don't automatically get the help. You have to apply for the help. So
Mm-hmm.
Part D does not come with A and B.
Mm-hmm.
Over the counter does not come with A and B. You can get over the counter as one of those extras with your Medicare Advantage plan. Your vitamins, your body washes, your body wipes, your canes, your blood pressure machine, your, all those essential extras. Those things will come with a Medicare Advantage plan, but you have to enroll in the plan
Mm-hmm.
to get it. It doesn't automatically come to you. So nothing is automatic.
Okay. Explain the grocery card, because if you look at America, the grocery card that I know some people have, you get once a quarter. And like, say Medicare says they're going to give you $75 a quarter. But if you break that down, that's only $25 per month.
Mhm. Very good question. So the grocery card is one of those extra benefits. It's not mandatory that the insurance companies put it with a plan. It's one of those extra carrots that they dangle in front of you and say, "Here, chew on my plan, choose my plan." So the grocery card benefit is just a bait. It's just, something that says, "Hey, if you choose this plan, you'll be able to get this benefit." But those people who qualify for full Medicaid because their income is under 1256, we put them in what's called a dual plan. And so someone that qualifies for a dual plan versus a regular Medicare Advantage plan, the dual plan is going to give them more grocery card benefits. So those grocery card benefits may be monthly. They can get up to $190 monthly in grocery card, electric bill pay. They can get, some of them even $200
Hmm.
that they'll get a month. But that's because they have low income and they have already been deemed Medicaid eligible. So everybody doesn't qualify for those plans. Now, there are some people who have chronic illnesses that will get a little bit more on those benefits cards, like those who have diabetes, heart, or cardiovascular issues. Now they may get $75 a month or $60 a month, whatever it is, right? But healthy people who have a higher income, it may just be, we're going to throw this little benefit in there to you that you're going to get $30 a month for over the counter, or like you said, $75 a quarter. So a lot of people say, I don't want that. I don't get $25 a month. And I hear that a lot of times. People say, I don't get $25 in food stamps. Well, $25 to buy a good uh, ribeye steak and some potatoes, that'll pay for a good meal. Or if you're trying to make it stretch, it'll pay for several boxes of cereal and some milk that'll, stretch. So,
Mhm.
but it's just a little incentive to keep you healthy. And that's the main thing. These plans in Medicare want to keep you alive because if you're dead, they're not going to make any money.
So
So,
so if somebody, so like you said, you and I hear it too, if they're getting over the counter, they're already low income, right? And so
not
they get,
necessarily,
okay,
right?
okay,
Not necessarily.
not,
Remember, I said some healthy people may
okay,
qualify. It depends on which plan.
okay,
Can I talk about plan specific, Greg? Okay, I can't talk about plan specific.
okay.
So,
Mhm,
so some plans that
mhm,
have the grocery card benefit or the over the counter benefit, you don't have to have a chronic illness. You don't have to have a certain income, but they're going to have those extra benefits as part of it. And it's not going to be as much as the person with the chronic illness or the person with full
mm,
Medicaid.
okay,
But there are some plans out there with those extra benefits, but it's not going to be as much.
okay. Let's roll over. Let me see if I have any more Medicare questions. um, let's roll over into so Medicaid. Is there any Medicaid?
All right. So, Medicaid, like I said, there are different types of Medicaid. If you have Medicare, you have to tell the people in the defects office that you have Medicare because they may give you the wrong Medicaid application. If you get
Mm,
the women and children Medicaid, and there's cancer Medicaid. So people that don't qualify for Medicaid based upon their income, they may qualify for Medicaid based upon their illness.
yeah.
So
Mm,
there's Medicaid for people with cancer. So for instance, I had a lady come to my office and her income wasn't low to qualify for Medicaid, but she was on a fixed income and she went to I told her to go to the DFAC's office and apply for the cancer Medicaid. And so they gave her that Medicaid to cover any illness or sickness or uh, benefit that she needed to treat that cancer. So
mm,
if she went in the hospital for cancer treatment, that Medicaid for cancer paid for that
okay.
treatment.
Okay.
Now,
Very good
if
information.
she went in there for a cold, then that Medicaid is not going to cover that unless that cold was a result of her, you know, catching pneumonia during her treatment and that. But there's different kinds of Medicaid. If you go in the nursing home
Mhm,
and you have assets and you have those assets in your name within 5 years of going in the nursing home, that nursing home Medicaid is subject to a look back period, 5 year look back period, and it will they will tell you if you have property in your name, they will put a lien on your property, and it's in the fine print, but people don't read it. And when my
mhm,
uncle put my grandmother in the nursing home, he didn't finish 12th grade. He drove trucks, so he made a lot of money. But, you know, people be judging people on the outside and thinking they have more than what they really have. You
Mm-hmm.
gotta look, you gotta dress up to feel good. And a lot
Yes.
of people with less will dress up to
Mm-hmm.
look good, to feel good. You know what I mean?
Mm-hmm. Mm-hmm.
So, he went in and filled out that paperwork, but he didn't know that he was signing over her house and her property potentially. He didn't realize that. And by the time, and he actually died before my grandmother.
Mm. Is
He,
there any other thing underneath Medicaid besides the women and the children, the cancer, nursing home?
um, so you got cancer Medicaid, you got women and children Medicaid, you, huh? Oh, yes, blind and deaf and disabled Medicaid. So individuals that are blind and deaf, um, people that are on that have been disabled since birth, like children with mental retardation, or uh, they may have a higher income, up to like 4,000 plus dollars a month, and qualify for Medicaid because their income a lot of times is based off of their parents'
Mm-hmm.
income. So I find a lot of doctors and lawyers whose children have been disabled, they're autistic, or they have mental retardation, or they have multiple sclerosis. Their income is, $100,000 a month. But when the children qualify at age 16 for Social Security benefits because their parents have reached age 62, right? Or 66, whatever their retirement age is. And now those children can start receiving disability benefits based upon their parents' income. So their income can be over $4,000 a month and still get Medicaid. But blind, deaf, disabled Medicaid, they can qualify with a higher income.
So let me ask you this: on a everyday basis, how soon should a person sign over their assets to their children or a grandchildren, another family member, in case when they do get older and their child puts them in the nursing home or hospice, that they're covered with their assets, that they don't have to sell their family's assets like their house and everything to cover that payment?
So my first answer to that question is they should seek an attorney. They should seek a lawyer. The person on Medicare can get a trust set up. There are all different ways to um, protect that person that's on Medicare so that if you put your house in your children's name and the children decide to kick you out and sell the house, there are ways to protect yourself from that, but you go through and seek that advice from an attorney, right?
Hmm. Hmm.
To in different ways to protect your assets,
Hmm.
because I do not advise anybody to put their house in a child's name that they don't trust, right?
Right.
So that's why we don't you
Right.
you right.
Right.
So our advice for that is seek an attorney
To
and
eliminate.
professional advice.
Right. So if you do it now, if you do it now, if you prepare the paper now, because we don't know when we're going to transition. But to be on the safe side, if you prepare the paper, file it in your local courthouse, or give it to somebody, not to the child that you're going to give it to, because they might kill you to get the house. But anyway, that was just a joke. But anyway, you understand where I'm going? If you prepare the paperwork within say you do it 10, say you do it, I don't know how I'm trying to say this. My question is, how soon do you do the paperwork? Do you have to acknowledge it now? Because if you turn it over in the child's name and you're in your 60s, the property tax is going to go underneath your child's age and bring your property tax back up. So when do
That's
you
that's
sign?
not that's not necessarily the case. Um,
Mm-hmm.
but again, the best advice will come from a professional estate planner or a professional lawyer, because those statements that you made are not necessarily true. So the person that, when my husband and I set up for our children, when, he's already over 60, I'm near 60, right? So you can determine at what age is the best age by talking with an estate planner, to set up that trust fund. Whereas you have, there's, and look, there's a difference between getting power of attorney and also being executive estate. So, and I'll just talk about me. I got power of attorney for my mom, right? But that power of attorney died when
Right,
she died. But the
right,
executive estate, when you become an executive estate, you take on that person's bills,
right,
right? And you take on their estate and it's tied to your assets. So you want to seek professional advice to cover yourself in that situation, so you don't go and put it in somebody that, doesn't have your best interests at heart.
right. So, okay, is that all the information you have for Medicaid, or is there anything else? Because we kind of got there. Is there any other information? Because this is good information.
Well, again, the different types of Medicaid, you want to make sure you ask for the right Medicaid for your situation, right? If
Hmm.
you're on Medicare, you want to ask for the Medicare savings application. If you're not sure, we can help you apply. We can
Hmm.
help you apply for the right Medicaid if you're on Medicare.
Okay. Now, um, veterans, if you have, I'm a veteran, and if you have uh, a veteran hospital card, and you have a Medicare card, which card goes first when you go to the doctors? Does one
When
over
you
is
say
higher than
you
the other?
when you say you have a Medicare veteran hospital card, you mean now, are you TRICARE or are you VA?
VA.
So you didn't do the 20 plus years.
Mm-mm.
Okay. So TRICARE for life and VA are different.
Right.
And so if you're a veteran and you have VA coverage, you're going to be connected with the VA through the service connected illness or injury. And if there's not anybody on that facility, on the base or at the VA, that can treat your illness or injury, then you can get a provision to go outside to a primary care specialist that treats that specific. But the VA is its own entity. So the VA is going to treat you for those service connected illness or injuries, right? When you are TRICARE for life, the the military doesn't want you to go to the VA. They don't want you to go to the military installation for your care. They want you to go outside, get you a primary care and specialist outside the VA. So both a veteran with VA or a veteran with TRICARE and VA have options when it comes to Medicare, right? So when you get one of these Medicare plans, if you're using VA coverage or Express Scripts with TRICARE, You do not have to get a Medicare plan that has Part D, as in drug, but you can get what's called an MA or Medicare Advantage only that comes without drugs. And these plans can help pay that Part B premium. So the Part B premium reduction. So in Georgia, the highest Part B premium reduction, I believe, is like $140. Now in Florida, the highest Part B premium reduction is $164.90. So it depends on which state you're in, um, and it depends on your needs. So I have a lot of veterans who don't want the Part D because they're continuing to use their VA card or VA benefits on the base, their drug benefits on the base or through the VA, or they're using the express scripts. But a lot of them say, hey, my drugs cost less, cost me zero in this Medicare Advantage plan. I want this Medicare Advantage plan that comes with drug. I want a full MAPD, Medicare Advantage plan with prescription drug, right? But those Medicare Advantage plan with prescription drugs, I think the highest premium reduction you can get in that is $100. But just because it gives you premium reduction doesn't mean that you want that premium reduction, because you might need more dental. So you want to get a plan that gives you $2,000 or $3,000 worth of dental, right? Which is more than, you know, $1,200 a year back in your check when you're getting $2,000 or $3,000 worth of dental. So it all depends on what your needs are. But anybody, all veterans are eligible for the Medicare Advantage Part C plan. If I could share my screen, I would show them the TRICARE for Life manual. I would show you the CHAMP VA manual. CHAMP VA, the spouse of someone getting VA benefits, their benefits are closer to what TRICARE gets, which, Champ VA covers pretty much everything, except why would somebody want to get a Medicare Advantage plan when they say they get everything? So
Right.
why would I want to go and get a Medicare Advantage plan from Patricia? Because
Yes, sir.
the VA is not going to cover eyeglasses unless it's part of your service connected illness or injury. TRICARE is not going to cover eyeglasses unless you purchase the Federal Vision and Dental Program, FedVIP. So that costs an additional monthly fee. Um, TRICARE is not going to cover dental unless it's part of your service connected illness or injury. VA is not going to cover dental unless it's part of your service connected illness or injury. So the premium reduction, that $100, $140, $164, the VA is not going to pay you money towards your Part B premium. Only the Medicare Advantage plan, which gets money from the federal government every month, and they have to provide those extra benefits. So when they just say, and I'm going to use $1,000 as a round figure, just say the government pays Humana, Aetna, United, Anthem, Blue Cross Blue Shield $1,000 a month when you enroll in the plan. The government says, this is an example now, I don't know what the exact figures are, 80% of that you can keep. So $800 of that $1,000 you can keep. But 20% of that has to go towards keeping that member healthy, offering them extra benefits, the dental, the vision, the over the counter, the transportation, the chiropractic care, because TRICARE doesn't cover chiropractic care.
Mm-hmm.
VA doesn't cover chiropractic care unless it's part of your service connected illness or injury. So the Advantage plans have the name Advantage for a reason. They have advantages that you're not going to get with original Medicare or with the VA or
So,
TRICARE for life.
so suppose okay. So a veteran goes to a doctor. and they have VA and they have Medicare. Can they choose which card they want to use, or does Medicare automatically takes preference over your VA?
Yes, Medicare is primary Medicare is primary to any other insurance that you have if you are retired and not working. If you are working, an employer group plan will be primary, right? But if you are retired and not working, Medicare is primary. And I would like to point out too that a lot of people don't know that their TRICARE for Life benefits are covered by Humana. A lot of
Mm,
people don't know that. But TRICARE for Life is administered by Humana as well.
okay, okay, yeah, all right. I experienced that. I was like, okay, all right. But is it true that you can, like, if a veteran needs a specialist, is it true that they need to get a waiver from their primary care doctor in order to see that specialist so they won't get that Medicare bill?
So if it's cardio service connected illness or injury, and you're normally going to the VA for health care, then if that VA facility cannot treat your illness or injury, then you have to get a waiver to go to an outside specialist to treat that, right? And
Mm-hmm.
so if you are going for a common colds or whatever, and you want the VA to pay for it to go to an outside doctor, yes, you have to get that waiver. Most definitely. That's if you just have VA. Now, if you got VA and TRICARE, you can go wherever you want
Mm-hmm. Okay.
as long as they
Very,
accept Medicare and TRICARE.
very good information. And I want to go back to just one thing, and then I'll let you go. Right now, you say that a person has to do 5 to 10 years to pay into their Medicare, their
10.
Social Security. 10 years, at least 10 years. So you know how they say generate the millenniums have to work until they're 70 to claim their Social Security. Are they still going by those 10 years, or are they going by a different system?
So you're mixing two different things. You're mixing
Okay.
Medicare with Social Security money. You can't mix the two, right? So
Okay.
Social Security is based upon um, age as well, right? So
Hmm.
for me, the full Social Security age is 66, 67. I'm sorry.
Depending
My
on your
full,
birth year.
depending on your birth year. So my full Social Security age is 67, right? So the millenniums, they can, anybody can log in. They can even call Social Security and ask, what is my full Social Security retirement age to get my money? So your
Hmm.
full retirement Social Security benefit, get your money, has nothing to do with your Medicare because your age to get Medicare is 65 or
Right.
16 years old or older based on a disability.
Okay. Thank you, Miss Mitchell. I'm glad I saw you, and I'm glad that I'm the type of person that I would approach someone with manners to get, if I see that can inform me with some information. I appreciate you. Thank you very much.
Yes,
Um,
I appreciate you for having me on too. And
yes.
I know this is a lot and we covered we covered a lot, but there's a whole lot more to all of these things that we've discussed.
Mm-hmm.
And um, when we go over this information with people and they hear it, it
Mm-hmm.
goes over their head because I promise you it went over my head when I was faced with it with my grandmother. And
Mm-hmm.
so we're licensed and trained professionals now. We're certified licensed professionals. So we have to go through training every year. Every
Mm-hmm.
year we have to go through training. So it should not be that hard that a person receiving Medicare should have to go to school to understand it. But we do offer seminars. We do offer one-on-one Zoom presentations. We do offer to come to your church. We do offer. And the best way, um, people, as a school teacher, we learn Bloom's taxonomy. People learn in different modes and medium. So what we've done is we've talked a lot without people having something to touch
To
and feel
tangible.
and read.
Mm-hmm.
So when we come back on, um, we'll provide some additional things for them to look at, and call me. We can do a one-on-one. We can do a seminar. We do turning 65 class reunions. So we'll
Mm.
provide we'll provide the cake and punch,
Mm-hmm.
and throw a turning 65 Medicare um, birthday bash, and
Mm-hmm.
teach people all about Medicare. It's never too early to start. People get bombarded by these telemarketers with flyers and phone calls starting at age 60, and it's really crazy. And
It
definitely
is.
by age 62, you're getting a whole lot of phone calls from people wanting to um, get your business with the Medicare Advantage plans, or and there's so many different ways to help you pay those costs of Medicare, like indemnity policies, and so much, so much. So to do a one-on-one, um, or to do a seminar at your church or your senior living facility, we'd be happy to come and do that.
That sounds wonderful. I have two things that I forgot to ask you about. The first one is, how soon should somebody sign up for Medicare? And then the other one is, can you tell us a little bit about renewing it? You know how they say every year there's an open enrollment and you have a certain amount of time. Is there any information that you can give me on those two topics?
So when you get Medicare for the first time, you have 3 months before your birthday, the month of your birthday, and 3 months after. So that's 7 months. You have a 7 month window to sign up for Medicare. 3 months before, the month of, and 3 months after to sign up for a Medicare Advantage plan. Now, there are penalties. If you do not get your Medicare Part B when you're first eligible, there's a 10% penalty for every 12 months or every year you don't have it. And so 10% of 174.70, that's $17.47. That'll be tacked on to your premium for 2024. And you cannot get Medicare again until 2025. So just because if you go within that 3 months and you don't, you go past that 3 months after and you don't get your Medicare, you can get a penalty. If you don't get your Part D plan within 63 days of you getting Medicare, then you're going to get a Part D penalty, and that's 1% for every month you don't have your Part D. So you have to sign up. And I forget. And what was your second question?
The second question is, before I get to that second question, another one came up. Can you get, when you get 65 and you're still working, do you have to apply for Medicare?
You can delay your Part B if you're still working and you have other credible coverage. So you have to have other credible coverage. Now, the Affordable Care Act insurance is not considered credible coverage. It is, and when you get Medicare eligible, you can't even get the Affordable Care Act. That's the Obamacare. So it
Right.
has to be credible coverage with prescription, hospital, doctor coverage. It has to be credible. You can delay your Part B until you get ready to retire. And then you got to sign up for your Part B.
Okay. And the other question I had for you was tell us something about enrollment, the yearly enrollment.
Oh,
If
yeah.
you
So
want,
the
mhm,
what we just finished up with is the annual enrollment period. That's from October 15th through December 7th. This year, the annual enrollment period was extended because of the hurricane, because of President Carter's wife dying. There was an extension. So if you did not sign up for a Medicare plan during that time, there is still time, even in January, February. And then when we go into January, there's the open enrollment period for people who already have a Medicare Part C plan who want to switch to a different company. So it's still not too late. So if you got hemmed up by one of these telemarketers, or you did not make a choice and you still have original Medicare and you're still paying 20% and you're still paying deductibles, we can still get you covered. It's not too late.
hmm, very good information. Can you
And
come
then,
on? Go ahead.
yes, because there's a lot, because there's also special enrollment periods for people with diabetes, heart, and cardiovascular issues. So there are different special enrollment periods that we
Mm.
can get people enrolled in also. So
Can
yes,
you can you come back on um, when it's almost time for that enrollment period in
yes,
October?
ma'am.
And
Yes,
for those who are just starting out and those who have to switch over, because a lot of people, Medicare is very overwhelming, like you said, and it takes time to kind of filter it and understand it and get a little bit at a time, digest a little bit at a time. So, and if you can do that, then you can come on and tell the community what it has, what are the new changes, what is
that's
not
right.
anymore, and are there any? I know all of them are competitions, but are there special um, Medicare insurance that's better than others to where you live, to the state where you live? Because sometimes you might get Humana. Something when your first time on your Medicare and you don't understand it, you might get Humana, and then you go through your network and you find out that there's not a lot of doctors underneath that network, or you don't care for those doctors. So now you have to wait until October to switch your plan over.
So we cannot use superlatives because we are contracted with so many carriers.
Right,
We
right.
can't use superlatives to describe one plan over another. What we do is show you everything that you're eligible for, and we go through the benefits of plan A, plan B, plan C, plan D. We go through the benefits of each one, and we let you decide which one is in your best interest for that year, right? And
Mhm.
in at the end of the year, if you're agreeable with the changes for the new year, you don't have to change to another one. You can stay
Right.
right there. But if you say, like you said, my doctor's not in network, I need to change my plan, then we could definitely change you to a different plan. Or if you say, I heard, because we get this all the time, the street committee will mess you up and have you up the creek without a paddle, and they'll dump you out the boat and take your boat and leave you floating, right? So don't listen to the street committee. But there are plans that we can change you in all year. So you're not on stuck per se.
Right.
And if we can't get you in one, we can always plan and make arrangements, a schedule appointment for a future date.
Yeah, because it's Medicare by no means is a cookie cutter thing. It's based on that individual's needs and what they're looking for and what will better suit. Right. Okay. Well, thank you, Miss Mitchell. I appreciate
Thank
it. And
you.
I hope the invitation to a conversation community and the new ones coming in I know it's Sunday and a lot of people are probably in church, but they can pick this up anytime. We'll appreciate the information that you shared with us today. And I'm going to talk to your husband because next year is tomorrow, but I'm going to schedule him in for Social Security.
Right. Happy New Year, everybody, and thank you
Happy
so
New
much for
Year.
having us on.
Thank you. Thank you. And I pray for comfort and peace for you during this time. Thank you for coming
Thank
on.
you, and you
And safe
also. Thank
travels.
you so much.
You're welcome. Bye bye.
Bye bye.
Oh, let me call her. That was awesome. Your call has been forwarded to voicemail. The person. Let me see. I'll call her back.
Hey, Miss Bailey.
Hello. I know you were excellent.
Hold on, just
Okay.
hold on, Miss Bailey, just a minute.
Okay.
So we're good?
Yes.
All right. And the receipt's going to my email. Oh, you got one for me. Yes. Okay. You're gonna drop them there. I need one of them to key and look at you. And drop the extra onto your drop it in the red box by the door. She's gonna give you another one. Yeah. Okay. All right. Hey, Miss Bailey.
Hey, I can tell you are an excellent school teacher because you are patient. The way you answer a question, it's excellent. I love it. I love it. I love it. How do you think it went?
I think it went very well. I think it went very well.
So what I'm gonna do is I'm going to set after we finish uploading, I'm going to send you the video and you can share it with.
Okay, very good. Thank you so much for sharing it with me.
Yes, and you can share with anybody you want to, and let them know that I'm here. They can subscribe to my channel anytime. And if you know anybody who wants to come on and have something what they're doing in the community, but next month I'm going to have on a lady that, oh my gosh, I can't tell you what she did, but she is a true child of God. What she did, she'll be on in early January.
Oh, awesome.
Yes.
Awesome.
So
now you got my email. You can do this on the email list. If you email out the dates and times.
Okay. And whenever you get to where you're going, I'll call you back up and schedule that appointment. Let me see right now, real quick, when your husband can come on, because I'm already scheduled down to February. Let's see. Oh, let me see. Let me look on this calendar here. I got to get ready for my New Year's brunch tomorrow. Okay. Let's see. January, February, March. Can he come on? Can he come on in March? I don't have anybody for March yet.
March. Greg, can you do? Yes, he can do it.
Okay.
Do the Social Security seminar in March. What date will that be?
Let's see. We can do it. Let's see. Let me see. 2024. Jesus. 2024 March. Can we do a March the 9th?
Greg, March 9th is a Saturday.
Yeah. Virtual.
Okay. All right.
I have him down. I'm putting it on my calendar right now. That's going to be another.
Heads up before
Oh, I'll be in touch before March. I'll probably be in touch at the end of February. Um, to conform my questions and get them together. So and see, that's why I let you know what I needed to know and let off. And so I didn't ask you the questions like I usually do, people. So you explained it excellently wise. So
Mm-hmm.
I didn't need to do that. But when we have conversations, sometimes I might have questions based on what you said.
Okay.
Oh,
Very good. Greg Mitchell. Uh, what's the name of it? Not classical conversation. Conversation.
invitation
Invitation.
to a conversation. Mm-hmm.
And if you would send, I'm going to give you his email.
Okay.
It's Magic Insurance Agent.
Spelled all the way out.
Yes, ma'am.
Agent. Uh-huh.
Magic Insurance Agent at
Mm-hmm.
Outlook. I'm sorry, at gmail.com.
Okay. I got it.
And what time is that?
Usually it's 11 o'clock in the morning. See, because anytime I go past 11, I'm out of my orbit. I don't know how I got stuck with 11, so that's, yeah, yeah. Mm-hmm. Okay.
All right. Yes, ma'am. Thank you so much.
Thank you. You have a blessed New Year's and safe
All
travels
right.
again. All right.
Thank you, ma'am. You
Bye-bye.
too.
Oof.